Morning. I am Anusha as a nursing tutor at Emmanuel Arthur College of Nursing. I am going to explain about false risk assessment. The false risk assessment. A false risk assessment is used to find out whether the patient have a low, moderate or high risk of falling. It is mostly done for older adults. The assessment usually includes an initial screening. This includes a series of questions about overall health and previous fall history or problem with balance, standing and or walking. A set of tasks known as fall assessment tools. These tools test strength, balance and gait, walking styles of the patient. Initial screening questions are: have you fallen in the past year? Do you feel unsteady when standing or walking? Are you worried about falling? False assessment tools are timed up and go, tug. These tests check the patient gait, walking styles. Patient will start in a chair, stand up and then walk for about 10 feet at a regular space. Then he will sit down again. Healthcare provider will check how long it takes to do this. If it takes 12 seconds or more, it may means at a risk, high risk for a fall. 30 seconds chair stand test. This test checks strength and balance. Patient will sit in a chair with arms crossed over his chest. When provider says go, he will stand up and sit down again. Patient will repeat this for 30 seconds. Provider will count how many times he can do this. A lower number may means at a higher risk for falling. The specific number that indicates a risk depends on age. 4. 4-stage balance test. This test checks how well patient can keep his balance. Patient will stand in 4 different positions, holding each one for 10 seconds. The position will get harder as he goes. Position 1, stand with feet side by side. Position 2, move one foot halfway forward so the instep is touching the big toe of other foot. Position 3, move one foot fully in front of other so the toes are touching the heel of other foot. Position 4, stand on one foot. If the patient cannot hold position 2 or 4, position 3 for 10 seconds, he cannot stand on one leg for 5 seconds. This may mean high risk for fall. Fall assessment scale is a Moore's fall scale. It's a brief fall risk assessment tool used widely in acute care setting. It is used for upon the admission as a discharge transfer to new settings. It will be used. Most false risk assessment history of falling immediately or within 3 months, number 0 to 0 no as a yes 25. Secondary diagnosis no is a 0, number 15 is yes. Ambulatory aid none is a bed rest, wheelchair nurse 0 is a crutch, can walker 15 and furniture 30. Gained or transferring number 0 yes 2. Heparin locked is a number 0 yes 2 20. And mental status oriented to own ability 0, forget limitation 15. Say scores are interpreting the most fall risk assessment. No risk 0 to 20 and none. Low risk 25 to 50. Say in initiated fall risk prevention. High risk 51, more than 51. Thank you.